Hi guys, so make sure that this is the second video that you're watching, not the first, for autonomic nervous system. So I'm doing this video because there's a little bit more detail on the PowerPoints that you guys might want to look at. But when it comes to the basics and the high yield, make sure the other videos that I post, which go over the high yield, are the ones that you watch. You will be using it in the future, I guarantee you, at some point in your career, especially if you go into the health field. So what do I have for autonomic nervous system? Broken down into two major divisions. Sympathetic, which is the gas for most things, except for the GI tract and urinary tract. And then parasympathetic, which is the brake for most of the organ systems, except for, again, GI tract and urinary. So fight or flight, sympathetic, also the gas. Rest and digest, parasympathetic, also the brake. So let's go over what that means. So I have parasympathetic, let's see what it says for. Sympathetic first, so it's the gas, right? Increases mental alertness, increases metabolic rate. But the opposite is true for digestion and urinary. Positive for energy reserves being activated, increased respiratory rate, opens up the airways. How many lungs do you have? 2 lungs. So what receptors do you find in the lungs? Beta 2 receptors. What about how many hearts do you have? You have 1 heart, so beta 1 receptors are found in the heart. So remember, this is a review for you guys. Parasympathetic is the opposite, right? It's going to be associated with a decrease in everything. It's like the brake. Decreased metabolic rate. For the heart, it decreases heart rate and eventually blood pressure. Decreases, let's see, all of these are associated with digestion, and urination, right? So they're going to be heightened or increased with parasympathetic. Enteric nervous system is another division of the ANS. We're not going to talk about that unless we're going over GI tract, and that's when we really discuss this a little bit more in detail. Parasympathetic and sympathetic. So sympathetic division is from T1 to L2. So again, T1 to L2, and because it's in the thorax and in the lumbar region, they also nicknamed this thoracolumbar. So sympathetic is called thoracolumbar. Sympathetic, here we go, is called thoracolumbar. Why? Because it's from originating in the thorax or thoracic vertebrae or the thoracic nerves, T1, and it extends all the way through L2 or lumbar nerve 2. So T1 to L2, thoracolumbar. And then again, you guys don't have to worry about chain sympathetic ganglia unless you go into med school. Adrenal medulla, this one is fun. It's the Dorito chip, right? So we have the Dorito chip with the cheesy filling. The very center is the adrenal medulla, and the medulla has epinephrine and norepinephrine. Epi about 80%, norepi about 20%. And if you look on the outside, this little cover is called the adrenal cortex. So the mnemonic that I have in the other one is AC, AC, amen. AC, AC, amen. AC, AC, amen. And what it means is ACAC, adrenal cortex, releases aldosterone and cortisol. Amen. Adrenal medulla releases epinephrine and norepinephrine, epinephrine in greater quantities. Fight or flight, sympathetic again, T1 to L2. So I'm trying to highlight over the things that I will ask questions on. Chain ganglia, no, not for your level. Sympathetic nerves. So we said T1 to L2, highlighting that. We can move on, T1 to L2. And then, don't worry about this. Primarily when you talk about cranial nerves, 3, 7, 9, and 10 are a part of the parasympathetic nervous system. Okay? So, right here is an extension off T1, and it feeds back up to these 3, what they call cervical sympathetic ganglia. For your level, you don't have to know this, but when it comes to med school, yes, you will be tested on this heavily. Okay, so what would it do to the eyes? Well, if I'm scared shitless and I'm running away from a lion, right, do I want to be able to see? I have to let light in. So what do I want to do for the eyes? I want to dilate them so I can let light in. Well, salivary, that's going to be affected. We want to focus, at least for my classes, on the eye, the heart, the lungs, all the things that are essential for us to run at this moment. So heart rate's going to go up. Lungs are going to open up. So beta 1 receptors found in the heart, beta 2 receptors found in the lungs. And then for the GI tract and urinary, what's going to happen to this is the opposite effects, right? So it's going to slow down GI or digestion as well as urination. And let's get to parasympathetic if we can. Don't worry about these. Adrenal medulla, we said. Adrenal medulla secretes epinephrine and norepinephrine. Which one in greater quantities? Epinephrine, also known as adrenaline, is secreted in about 80% of all that's coming out of the adrenal medulla. The rest of it is norepinephrine. So sympathetic activation, alertness, let's get to the other high yield stuff. So we said alpha 1, alpha 2, beta 1, beta 2, beta 3, ERAD, ERAD, E. Alpha 1, alpha 2, beta 1, beta 2, beta 3, ERAD, ERAD, E. If you don't remember what that is, go and watch the other video. That's the whole point of that. So alpha 1 receptors are found anywhere except we said high yield location is going to be a blood vessel. And if I cause constriction of an alpha 1 or I stimulate an alpha 1 receptor, it's going to cause constriction of the blood vessel. What would I use to block alpha 1? I could use something like Zosyn, right? And that's used to treat high blood pressure, otherwise known as hypertension. Alpha 2, this one is relax and dilate, right? So it opens up whatever it's attached to. In the case of a blood vessel, or this one is technically found centrally, meaning in the brain, and if you activate this, it decreases the amount of chemical that is being released, and it will lead to relaxation. So that one is probably a harder one for you guys to understand unless you study it a little bit more in depth later on. So beta receptors, primarily I want to look at the one in the heart and the one in the lungs. Beta 1 receptors in the heart, beta 2 receptors in the lungs. ERAD, ERAD, E. So excitation of beta 1 receptors, which are found in the heart. So if I stimulate a beta 1 receptor, its function is excitation or contraction. It would lead to increased heart rate, increased stroke volume, increased cardiac output, increased mean arterial pressure, and increased overall blood pressure. Beta 2 receptors, on the other hand, are the opposite, and they are for relaxation and dilation. That's their function. So if I stimulate beta 2 receptors in the lungs, they would cause relaxation and dilation of the airways in the lungs. And what would you use to treat someone that has asthma? I would give them either epinephrine, which is short acting but immediate acting, or I could give them their emergency inhaler, which is albuterol, or we could use something to maintain the airways and reduce the incidence or occurrence of asthma, and that would be something like salmeterol, which is a long-acting beta 2 agonist that is used to treat asthma, but it cannot be used in an emergency situation.
I got it.
So here we go. I have beta 1 receptors found in the heart, beta 2 receptors found in the lungs, beta 3 receptors, ooh, one of my favorites, lipolysis. If you stimulate beta 3 receptors, then it can actually trigger the breakdown of fat. Diet pill. They actually do have a drug on the market. It is mirabegron. Mirabegron is a beta 3 stimulant, and typically it's used for overactive bladder, so it helps to relax the bladder. And then what do we have?